NHS activity has seen an increase. When we are looking at the NHS activity, we can see that UDAs are up. Total patient revenue was up to 774 million. Hi everyone, I'm Anil. I'm one of the practice consultants at Dental Elite, and today during this water cooler we're just going to share with you a couple of interesting points on NHS activity on the back of the recent update by the NHS BSA. So the general consensus of this report was that NHS activity has seen an increase, small but significant. And I think that's crucial, especially on the back of the last few years, year on year, when we've seen a downwards trend, especially when reported by Nuffield and other organisations. So it is positive. When we are looking at the NHS activity, we can see that UDAs are up, individuals offering this service is also up, and in terms of courses of treatments have also increased. So now what we are going to do is dive into a couple of these stats and figures. So the headline figure for me is that total patient revenue was up to 774 million, and that shows then a 2.7% increase in the NHS income and growth. Now, when we look at this on a more specific and granular level, specifically to courses of treatment, what we saw was 34 million courses of treatment, which showed a 4.3% uptick. Now, of these courses of treatment, adult courses of treatments were 2.2% up, and then we saw children courses of treatment up by 9%, so quite the difference there. Now, when we are looking at the bandings on this, what we saw was actually the key contributor towards the courses of treatment were the band 1s, which were up by 10.2% as an increase. So 56% of the courses of treatment were from band 1s. And then when we were reviewing band 3 courses of treatment, these actually saw an 11.9% decrease. So when I'm looking at this data and when I'm now making reference to our benchmarking report, what we found in the benchmarking report was that actually revenue across all practices showed an increase on the private side of income, and this loosely translates or ties in with that, because what we can see is with band 3s now reducing compared to last year, this year round, it shows that there is an upsell value there through those patients towards the private scale of treatment. But I think overall the sentiment from this is that there is positivity on the NHS side of things, and we have to wait and see what happens when contract reforms come in under this Labour government, as well as, of course, relaxation of rules around OREs and, of course, overseas dentists. Thank you for listening, and see you soon.